Innocent Whispers ASMR. Is the zone secure? Are you sure? Can you pass me the notes? Thank you. Okay. Let's take a look. I haven't come across a case like this in a while. Let me just take a moment. Okay. Patient has been in quarantine for 2 months. Yes? Interesting infection. Saw something similar of a alien nature, shall we say. Okay, have you secured the patient's room? Fully disinfected? Yeah? Okay. Could I please gain access, just by myself, please, to evaluate the patient further? Yes, I'm fully equipped. Yes, I am a specialist in this field. Please don't insult my intelligence. Now, can you give me access or not? Good. Well then. Hello there. Can you hear me fully? Good. My name is Dr. Carter. Why aren't I wearing quarantine clothing? Well, I've been exposed to a number of quarantined diseases, so luckily I do not require one today. Now, your condition is one I haven't come across before. It's very similar to one I've seen, but I haven't seen the exact one. You've been in here for 2 months? Okay. Let's take a look. Okay, I'm just going to... Okay, you're just going to be strapped down, okay? Yeah, you just want to pop over the arms. Struggling probably won't help. Good. Yeah, let's do the ankles as well. Good. Do you have a... Yeah, could we do that as well? Yeah, just until they calm down. Ah, thank you. Thanks. That's better, isn't it? More cooperative. Yeah. Okay, so you're just going to be able to nod or shake your head. Okay? Now, I am a specialist in this field and I merely just want to take a little look at you. Okay? See if I recognise any of the signs and symptoms and therefore see if I can find a cure for you. So, I'm going to start by popping on some gloves. I may have been exposed to a lot, but well, better safe than sorry. Right. warming them up for you because I'm nice like that. Don't shake your head. Now, let's start by checking your heart rate. Okay, so normally patients of your type will experience a rapid heart rate, so I just want to measure that. If you could, I'm going to listen to your breathing as well, so if you could just maintain a nice steady breathing pattern, yeah? Okay, interesting. You do have a fairly rapid heart rate. Just pop that down. Looking back at your notes, you have not responded well to the medications given and the experimental antidotes. Interesting, almost like your body is resisting. Okay, I'm just going to take a little look in your ears, okay? Now I notice you've got some swelling on this ear. It looks a little infected. So we're going to take a little look, okay? I've got my little piece right here. Let's pop that in your ear. Let's take a little look. Very interesting. Yeah. Interesting. This ear appears to contain some sort of glowing substance, which is very interesting. I saw that on a cross-contamination once. Could be a leakage from elsewhere in the body. Yeah, here we go. Okay, let's see if your eyes are functioning normally. Okay, I'm just gonna use this little torch. Just shine a light in your eyes. I just want to check your pupils. Okay, so just look directly at me. Okay. Pupil reaction is fairly rapid as well. Would go in line with your other symptoms. Now, you have still quite a few open wounds. I see from your notes that is a result of some of the antidotes fighting their way back out. Yeah, okay. I'm going to take some samples from that, so if you just want to, I was going to say sit still, but that's handled. Okay, so I'm just going to take a little sample here. Some of these can be flesh-eating bacteria, so although I'm sure the lab has taken samples, I like to do my own and have my own team evaluate. So let's take one from here. Okay. That's lovely. Okay. Just stick that in there. Let's put the jar over that. Let's put the lid over that. Lovely. There's also just one on your leg I'd actually like to take. Oh, it's a little stuck in there. Here we go. Okay. Oh, I know, it's a bit painful. Let's pop that in. Not bad. Should be a good sample size. Very good. Okay, so I'm going to clean up some of those I just opened further. So I've just got my little wound scissors. Let's have a look. I always find carrying my own equipment is much wiser. So I've got some nice wound covering pads here. I've just got some saline for wounds. Some of the antiseptic tablets I'll probably use. Oh, here we go. This is the, open it up. This is the bandage. I'm just going to pop that over the one on your arm. Okay, so let me just cut that. Okay. Let's just place that over your arm. Lovely. That wasn't too bad, was it? Now I think I'm going to use a wound pad on your leg. Okay, because that is considerably more infected. I'm actually going to pop a little bit of the saline on that first. Let's clean that up. Okay. If you could just try not to flinch, that would be great. Okay. I know it stings. Let's do it with. Okay, I'm just going to go in with the is new? Okay then, I think my work is done here. Just put those gloves down there. Let me update these notes. Now, if I take your gag off, are you going to scream? No. You sure? Okay. Good. Calling me names will not help your situation. Okay, well, I've taken my samples. Just gonna pop that in here so they know I have. Obviously, I'm not a local here, so as soon as I have the results back, which could take up to a couple of weeks, I'll be flying back over to discuss further with you, okay? I suggest, in the meantime, you try and stay as calm as possible. I mean, they give you a TV, so watch some TV. I'm going to be recommending that they take you off antidote C28. I think that could be increasing your pupil responses. Also, the ear infection, I believe, has been started from that. That drug can cause a cross reaction, so no. The good news is I do recognise some of your symptoms, and I have been able to treat those. So, fingers crossed, if the lab results come back as I think they will, I have something that I can give you. Now, it's not going to be an instant cure. It could take a couple of weeks to fully sink into your system. Okay, so obviously I have all your other vitals and stats here. They seem to be tying in with what I'm seeing. So, that's good. Physically weak to be, expected. As well as stopping that particular antidote, I'm also going to take you off a couple of your medications. I think they're accelerating the rates of expulsion in your body in regards to the wounds, so I'm going to take you off that. Okay, that's me done here. Now I'm going to send them back in to, well, untie you. Thank you for your cooperation, and I will be in touch shortly. Okay, just stay positive. Bye bye now.